Hi, everyone. My name is John Faulkner, and I'm your host of the Smarter Systems, Better Care podcast. I'm here today with Dr. Kenneth Levey. He's the CEO of Mother Goose Health to discuss how his team is reimagining maternity care through digital innovation and care coordination. Thank you for joining us today.
Thanks for having me.
Absolutely. And just to kick us off, to give our listeners some context, tell us a bit about your background.
So I'm a board certified OB-GYN. It's been that way for nearly 25 years. I started off my career working in academic medicine at NYU Langone Medical Center and on the full-time faculty, and then left for private practice. Since then have developed what's now the largest privately held practice in New York City, focusing on women's healthcare. Throughout the entire course of my career, I've been very interested in and highly focused on developing systems that make life easier for both patients and providers. So I got involved in the tech world in the early 2000s and had developed multiple platforms for running the back-end operations of medical practices. Since then, having sold those platforms and also continuing to use them in the medical practice, I really got involved heavily in understanding how the practices that we're running work and interact with both community, patients, health systems, as well as a focus on critical contracting issues. In about 2017, 2018, I got really involved in what's happening in the maternity care space, understanding that the United States is the single most dangerous place in the developed world to have a baby. And this, of course, bothered me and frustrated me and didn't make sense to me. We really do have incredible healthcare providers in that system who truly care about patients. So I went out and tried to figure out what the problem might have potentially been, and spent a tremendous amount of time looking into it, and came up with the idea and understanding that it was a misreading of what's going on more broadly that people were presuming was wrong with our system were related to two things. One, everyone presumed, well, we just have a difficult to manage healthcare system and these patients don't always have the means or ability to navigate it. But that didn't really sit well with me, because other specialties that take care of similar patients have really great outcomes. Cardiology was doing very well. Cardiothoracic surgery was doing very well. Orthopedic surgery was doing very well. And these were places where they had really focused on doing something that we're doing in maternity care now, which is consolidating the market. The other item that folks had presumed was not being done well or bad or leading to these adverse outcomes was a notion that there was some fault in the hospitals. And this is sort of a really bad data disconnect, in that, sure, adverse outcomes often occur in hospitals, but aren't necessarily related to hospital systems or fault of hospital systems, knowing that women who go to hospitals to have babies typically get prenatal care in the ambulatory or outpatient setting for 7 to 8 months before they go to the hospital. So there must be something going on in that 7 to 8 months that's leading to adverse outcomes in these patients. And as someone with a master's in public health, this was a really interesting epidemiology problem to me, sort of how I landed in this maternity care management space.
Excellent. It sounds like you've been in the space for a long time too, and you're definitely not new to the startup world. It sounds like you've been through it a couple different times as well.
Yeah, the startup world teaches you a lot of lessons, because it's sort of like throwing a 10-year-old kid inside of a rugby scrum.
Yeah, it can be brutal sometimes, right?
Brutal.
Yeah, yeah, absolutely. And how do you serve your clients?
Mother Goose Health is really and maybe it starts at a higher level of the conversation. Mother Goose is really a comprehensive maternity care management platform that serves multiple different types of clients. So we have end users who are patients. We also have end users who are providers and office staff. And then we have clients who are health plans. We have clients who are integrated delivery networks, health systems that often come with their own health plans. And we have clients who are employers. For each one of those clients, we have a different value proposition. So for end users, patients and physicians, we make their lives easier. We manage workflows on the back end for them. We add revenue to their practices and make it very easy for them to add that revenue to their practices by doing a couple of things that they may not be doing. And for patients, we're helping along sort of this continuum of their pregnancy journey that starts really at conception and ends, for us anyway, at 1 year postpartum. And all along that time, we're doing all of the in-between visit work that physicians either don't necessarily have the time to do or the resources to do. And if you consider a 5-person private practice in obstetrics, to hire even a single care manager to do the level of work we're doing is going to cost them $70,000 to $80,000 a year in most markets. So that becomes a really big burden for that particular practice, plus the systems they have to implement to do so. Mother Goose is already set up and doing that. So we're offering this really comprehensive care management experience to the patients, connecting them with an RN care manager. And what we've done is we've brought in a unified fashion all of the services and all of the understanding of data and the value of that data and all of the care coordination to any one of the necessary lactation consultants and mental health professionals and physical therapists and doulas and DME providers. And we've put this really all in one cohesive space without actually owning any of those companies, and really created a true marketplace around the maternity care environment that benefits now employers who don't have to go out to a bunch of single point solutions. They could bring a single maternity care solution that's a comprehensive platform. In providers can utilize us and eliminate all of their frustrations around referring patients to any one of these services or dealing with any one of these services. Health plans can utilize Mother Goose in a way that supplements their current care management team and makes it easier for them to understand the data and understand what's coming in. And in particular, and very important for health plans, patients, and providers, is that because we're set up from a data standpoint, the way we're set up, and because we have the analytics inside that we do have, we're able to predict risk, not just baseline risk and not just understanding an outcome when it happens, but Mother Goose is set up to predict and analyze changing risks throughout the course of the pregnancy. So if you know at baseline someone's high risk, let's say you say they're high risk and they have an 80%, and because of that, they have an 80% chance of a particular outcome, you're already implementing services on behalf of that patient because you know they're almost certainly going to have a problem. But if somebody has a 10% chance of a particular adverse outcome, you're probably not going to implement those services until when?
Yeah.
Well, you don't know when. You don't know until it happens, right? So you don't know that at 10 weeks you evaluated them and they have a 10% chance of X adverse outcome. And then at 20 weeks, that number has risen to 30%. And then at 32 weeks, the number has risen, to 57%. Now you've got a 5-fold, 6-fold elevation in the risk profile. Isn't that something you would consider reevaluating a little more carefully, even if you're not going to act on it particularly fast? So that's the kind of understanding that Mother Goose brings to health plans and to physicians to allow them to mitigate their risk of any particular obstetrical outcome. And health plans love this because the ROI on their spend is at least 4, if not up to 9.
Yeah. Because they're trying to mitigate that risk for the patients if they can be more proactive about their care plans than with the patients and they're able to predict the risk. I can see why that would be like an amazing ROI for them because, they're always unfortunately looking at the financial aspect. I'm always concerned with the patient outcomes, but if you can mitigate the patient outcomes and lower them, then overall it works for everybody, the patient, the payer, everybody.
Yeah, and we understand, and it's our understanding that the health plans really obviously want to do this. They want to combine this intersection of how do we save money and still help patients get better outcomes. And obviously, the health plans have a financial mandate, but they're human beings too, so they need to pay attention to that side as well, and they do. And the part that they're not always able to get to is the early risk identification piece. And because they get some claims data and they don't even know someone's pregnant maybe until 16 or 18 weeks, and if that, then they find out the risk profile at 20 to 22 weeks when it's often too late to mitigate some of that risk because they've missed 3 solid months or whatever that number is of opportunity.
Yeah, absolutely. And when you look at your specific role too as a CEO, where do you spend the most energy driving growth in day to day?
So on a day-to-day basis, I spend my time looking at the systems that we're operating inside of, is doing my best to try to understand where there's opportunity for us to slot in and what the reason I say that and the reason I put it in those terms slot in is because Mother Goose doesn't necessarily need to be a single solution for any one problem. Mother Goose exists by working with and inside of the existing systems. So where is there opportunity for Mother Goose to fill in a gap? Is a question I'm constantly asking. Where is there opportunity for Mother Goose to act as that? We always hear that CTOs and CIOs of health systems want to take 10 solutions and replace it with one solution. So we're always looking at where does that exist? Where is that possible? Where are you using 7 different maternity solutions where Mother Goose could be the single replacement at a lower cost for all of it? So those are the kind of opportunities. So it's really in the understanding of not only the clinical systems that are operating, but also in the financial and payment systems that are functioning as well. And then the question along that line becomes, where does Mother Goose work for either a health plan or an IDN or an ACO to not necessarily disrupt, but help mitigate, not to disrupt their payment system, but sort of mitigate the risk along each step in that payment system.
Yeah, absolutely. And it sounds like you said kind of not necessarily filling the gaps per se, but being like an enhancement to just make it better. And if there's an opportunity to replace multiple systems, that's even bigger win for everybody, right? It just makes it much more clean for patient care in the business.
And that's often when we go to pitch to a hospital or health system, that's the most common way for us to be able to do that, right? Is to say, hey, you're using A for lactation, you're using B for mental health screening, you're sending text messages via C, you've got internal care management team, and your system for getting breast pumps to people is all over from inpatient to ambulatory. It's not even one system. So we can replace all of that at, you know, 60% of the cost.
Yeah, that's amazing. And like when you're looking at a bigger picture too, like the industry as a whole in this area, women's health, maternity care specifically, what's like one shift in the industry that most leaders are not paying enough attention to?
I think the biggest item that folks are missing, I don't say if they're not paying attention because there are always a lot of people talking about how to do this, but nobody really has come there yet. And I hate to use the terminology um, value-based care, so I won't. But this is sort of part of that continuum of thinking about value-based care, which everybody identifies in a kind of a different way. But what they're really not thinking about or really not considering is across the continuum of care of a maternity episode from conception to 1 year postpartum, including cost of care for the neonate, especially if there's a NICU admission. They're not thinking about that total cost of care and how to mitigate the entire piece of it. And I think that opportunity for either shifting the risk on that total cost of care or simply working with a platform like Mother Goose Health that's been shown to be able to decrease that total cost of care is something that's generally missing from the thinking. And Mother Goose Health has the opportunity for a health plan to shift the risk from what they're doing, which is paying a global fee and then paying all of these extras that physicians and other providers will bill for, plus the cost of the baby and the anesthesia fees, to doing really what's truly inside of a bundle or a bundled care. And that's something that's been going on in orthopedics and cardiac surgery, and I believe now in neurosurgery, and in all sorts of other areas, packaging up the entire cost of care, saying it's going to cost us $1 per pregnancy. We know exactly where that dollar is going. It's going to Mother Goose Health, and Mother Goose Health then becomes the risk entity, the risk bearing entity for the cost of that maternity episode. And the health plans, because they're not maternity health plans, right? There's no such thing as a maternity care health plan that I particularly know of. Don't always have the time or resources or teams to focus on isolating maternity care risk, but that's what Mother Goose does. That's what we think about and do all day. So how do we make this better? How do we make this easier? How do we make this lower risk? How do we intervene early? Is something we do all day. And to shift the financial risk onto a platform that does that makes, to me, a ton of sense.
Yeah, absolutely. And it sounds like you're making a lot of great headway And like when you look at your like day-to-day operations within Mother Goose too, like where do things feel clunky or like slower than you'd like to see?
Look, the funny thing about running a health tech company is that the tech moves super fast. I always say this to people. It's one of my favorite. The tech moves super fast, but you know what doesn't move fast? Healthcare,
Yeah,
medicine.
healthcare.
And you know what doesn't move at all? Biology. It doesn't move at all. It doesn't matter how much tech you apply to it. The biology of human beings doesn't change from like week to week like the tech does.
Exactly.
So yeah, so I think about what's clunky. We're a victim of what's clunky about the system, right? And when we started Mother Goose, we knew that we weren't going to go change the healthcare system, right? That's not a thing that people do, right? That's something that Congress and Wall Street does. That's what changes the healthcare system. We work within the healthcare system, and the healthcare system is clunky. So the parts of it that we run into problems with are things along the line of payment, of how are services getting paid, of contracting is a constant battle. Like the difficulty in getting multi-state contracts, that's always a clunky issue with not an easy way to solve, something that's not easily solvable. There's the constant problem around interoperability, and we've spent a huge amount of time, effort, and money on data normalization. So we've sort of solved that problem on our end, but how the EHRs talk to each other is always a big challenge. And I know the industry. I remember hearing a bunch of industry executives in the EHR industry saying they give themselves a B plus on interoperability, and everyone in the audience at the meeting was like, "No, if you're lucky, it's a D. I might give you an F." So that continues to remain a challenge. But what we've excelled at is really the key piece here, because we've excelled at taking the clunky pieces and putting them together into a user experience that makes sense and that feels good and drives significant engagement both among providers and among patients.
Yeah, it definitely sounds like it. You've definitely put the pieces of the puzzle and used like your tremendous amount of experience to do that. And it sounds like you had an amazing team that you're working with to kind of get that together. And like you said, you're realistic too. You can't solve the health system. It's just such a huge problem. It's like, it's not that it's what's the point? It's just like, what can I do in my niche to make it better? Right.
Yeah, and the daily goal is, how do we make it more usable? How do we make it more personalized? How do we make it more engaging? How do we use the technology that's available to us to do so? And
Absolutely.
that's really where we've spent our time focusing. And we've from day one, we've had this really critical piece that's contributed to our thinking, which is that we had to focus in order to make multiple parties happy. We have health plans and IDNs and physicians, and they're all, and I'm a doctor, so I get to say this. So it's like herding cats with physicians, right? It's really difficult. And patients in multiple demographics and geographic locations. How do we make all this happy? And it comes down to one real concept, right? Which is human-centered design. Because once you start thinking about human-centered design and how we can take those disparate pieces of the system, put them together, put them down a single pipe, and then make multiple outlets for that pipe that really personalize the experience, then we've started to make it make sense to people where they really want to engage. It's a huge challenge in health tech engagement, right? Because most platforms, if you look at even the biggest multi-billion-dollar platforms, they only engage patients at an 8 to 10%. If they're lucky, they get in the low double digits, right? And again, I'm saying this without defining how these other platforms are defining engagement, but let's define something. Mother Goose has a 76% download and registration rate.
Wow.
That's astounding,
Yeah, that is astounding.
right? And without diving into the details, we have a huge retention rate going forward throughout the pregnancy. Obviously, it drops off later in postpartum, but in early postpartum and through the first 3 months, it's really strong. This is about engagement. Outcomes in healthcare are largely linked to engagement. If you can't, if you know, we looked at all of these blood pressure pilot programs in multiple states and said, well, all they're doing is throwing blood pressure cuffs out there and hoping the patients, one, use them, two, record the data, one, use them, two, use them properly, three, record the data, four, use our system for transmitting the data, whether that's an email to their doctor or entering something in an app or even connecting Bluetooth to an app. These aren't human-centered design approaches. These are, let's grab some money and make a big public announcement, and the And then, the programs, whether it's we're going to do a big doula program or we're going to do a nutrition program, we're going to do a food as medicine program, they all wind up failing because they're not focused on engagement. They're focused on like 10 steps down the road from engagement, which is providing the UX and the product.
Yeah, they're looking too far ahead instead of like the immediate, like right in front of them, what they really need to work on first. And then they can focus on all the cool, nifty features and all those fancy things, right? So,
Absolutely. Once you've achieved a methodology for engagement in a local market, then you really know how to move forward. And some of the challenges that are created by the disparate healthcare systems are those local challenges. And a platform like Mother Goose is adaptable to those local challenges. One of the, again, sort of early modalities of understanding or way of thinking that we've continued to utilize at Mother Goose is that healthcare is local. Healthcare is not a national thing. Now we have a nationally oriented healthcare system that is built around a set of regulations that also, of course, even within a state, well, state to state regulations are going to vary, but even within a state, healthcare is still local, right? So counties and localities have different needs. They have different disease states. I mean, there are some localities that have no pregnant patients, right? So do we need a labor and delivery unit there? No, right? But there are some that have more. So yeah, we do need to focus on some obstetrical care there. So we really take this healthcare as local approach and use local ancillaries, and do our best to adapt the engagement to local customs and what's going on in a particular area.
yeah, that's an important realization too, is like it's a local aspect because the discussion is always like national, like how are we going to change the healthcare system? But it's important also to realize it's different from even city to city. It's very different. How what the approach is from the physicians, from nursing, the entire care team could be very different just because they have an understanding that the rest of us don't have about their particular healthcare system where they're located. And once you get through all these bottlenecks, if you got a magic wand, right? I always like to ask this question, like, what would success look like in 6 to 12 months for you guys?
Well, so there are, always two aspects we think about when we think about what are we doing and how are we proving success, at least to ourselves. One of them is absolutely, distribution and clients, right? So we need to, if we look on the short to medium term, 6 to 12 months and beyond up to that 3-year mark, we're always looking to increase the number of potential patients that we can contact, knowing that we're going to get about 75% of them to engage into our platform, and in some small niches, some small pieces of that, we're up to 90%. So there are some places where we've engineered it to do really well and try to take that model out. Increasing the volume of what we're doing would be very successful. Would be part of our success. Starting a pilot with some new financial modeling health plan while they like to engage, and we're actively in conversations, some deep conversations with health plans to start some of this new financial modeling and some of the risk shifting in a few markets. Saying that's going to happen in the next 6 to 12 months would be probably unrealistic, but would be very nice. And then the other part is continuing to improve on something we've already shown, which is the second, like there's part A, part B, and then not in that order. They're on the same plane as the financial success for the company, and then there's the clinical success for what we set out to do in the first place, which was to optimize maternity care outcomes. I mean, Mother Goose has already proven that we can reduce preterm birth rates by 54%.
Wow.
We've already shown that data across multiple demographics. In fact, the Mother Goose demographic, where we originally showed that success, was a demographic that actually mirrors the demographic of pregnant women in the United States. So 62% of those patients were non-white. 52% of those patients lived in socially high-risk zip codes, according to the CDC's Social Vulnerability Index. And 45% of those patients were Medicaid recipients or had their obstetrical care paid for by Medicaid, which is the demographic of the United States with regard to maternity care. So we've already showed in a broad way that we can make changes. And when you adjust for maternal morbidity, the numbers don't change, right? We still achieve statistically that success.
What's like the longer term goal that you guys would want to focus on?
Yeah, the longer term goal is really to eventually be a company that is one recognized widely as the leader in maternity care and comprehensive maternity care in the United States, to continue to develop networks around that. And over the next couple of years, with the providers that are going to be in those networks uh, under an alternative financial model, which is where Mother Goose is taking risk on the cost of maternity care, really spend our time, which is what we're developing now, really spend our time focusing on quality and be insanely perfectionist about the quality, in that we will make rules and follow those rules. Again, as a physician, 25, 30 years in healthcare, I can tell you that one of the things we don't do well in healthcare as an industry, as a profession, as a profession, is we don't we're not aggressive about quality. We have quality meetings. We set policies with the repeat offenders that fall below certain metrics, take their licenses away often enough. We don't kick them out of hospital medical staffs often enough. Often what happens, and we love, one of the recent examples, this neurosurgeon who gets shuffled from hospital to hospital to hospital, and, the guy barely knew what he was doing. And there are many, many examples of this. So we have to be rigorous about quality. We have to be rigorous enough to say in a contract, if you fall below these measures, you're going to get an X month warning period. If you continue to fall below these measures, you're out of our network, which means effectively, if we're contracted with health plan X for a certain rate, we're only getting that rate. If your mistakes are costing us more than we're getting, and because you're falling out of that quality, you're also out of our network, which means effectively you can no longer see patients that participate in health plan X. So it's a big deal. It'll be a big business deal to them, and they're going to want to comply, and they're going to want to do things under our recommendation that bring them into that level of compliance. Is something that Mother Goose is really going to spend its time focusing on. That also applies to our network partners who are the ancillary. So, if we're working with a lactation consultant provider who participates in our network, and we have several already, and we find that their costs are too high because they're seeing patients for too many visits that are unnecessary, or they're getting reviews back from the patients that are giving them persistent 1 and 2 stars for service, then they're likely to be out of the network, right? And they won't have an opportunity to get back in for like 5 years. So yeah, there are going to be consequences that are tied to quality and reimbursement, which is, I think, what health plans try to do. But of course, they're constantly running into legal challenges. We're hoping to avoid some of those issues by being upfront and rigorous about it, and anything but arbitrary, and utilizing clinical evidence in the evidence in the literature that says you don't hit these measures, you're at a risk.
Yeah, absolutely. Well, thank you for your time today. So where can people find you if they want to learn more or have a discussion with you?
Sure. We have a contact form on our website at mothergoosehealth.com.
Excellent. Well, thank you for your time today, and it was wonderful to have you.
Great. John, thanks so much for taking the time, and hope you have a great day.
You as well.
Good. Bye-bye.